Hello, everyone. My name is Walaa, and today I'm going to be introducing you to our pharmacy outreach program. So to start out with, I just want to go over what the pharmacy outreach program is. It's a program where it provides free information and referral services that might help people take their medications appropriately. So what do? We could actually help you afford your medications by telling you about what's out there, what's the best options that are out there for you. We can tell you how you would take your medications, what side effects you might expect from them. What do you do if you ever experience a side effect? We can tell you about how they work. We are funded by the Executive Office of Elder Affairs, City of Boston Age Strong Commission, Central Massachusetts Agency on Age, and MCPHS University, which I'm from. So next, I'm going to talk to you about how do you connect with us. If you ever have questions, you could always pick up the phone and call us. Our phone number is 1-866-633-1617, and we work from Monday to Friday from 8:30 to 5 p.m. You could also reach us on our website, which is www.mcphs.edu/pharmacy outreach, and utilize the Ask the Pharmacist feature to get help with your medication questions. We do a couple of virtual outreach events throughout the state, so you're welcome to join. I just wanted to talk about who we are. So we are staffed by case managers, pharmacists, and pharmacy students such as myself. What do? So we are there to help you. We're there to answer questions about medications and disease states which you might have. We're there to provide one-on-one medications reviews. So you could come in, talk to us about concerns you have about your medications. You're not sure if you're taking the same thing, if you're taking, not sure. Whatever questions you have, we could sit one-on-one and review it all with you. We could research ways to save on the cost of medications and to compare different insurances together, and we'll be glad to do that for you, and you can make up your choice at the end. We could evaluate the current insurance plans or insurance plans for the future, including Medicare Part D, for the most cost-effective options for you, and you could decide upon that after. We do education events, such as we educate at our community events on many health and prescription assistance topics. And next, we're going to have one of the health topics that might be of interest to you for you. And we're going to have Brittany, Mirna, and myself present on that.
Okay, hello everyone. So my name is Brittany. And along with my classmates, Mirna and Walaa, we will be talking with you about how the pandemic has just slightly changed some normal day-to-day activities, including going to the pharmacy. So we know many of you may feel anxious about going out in public, but we're here to assure you that all of the stores and the pharmacies within them are adhering to the CDC guidelines to lower everybody's risk of exposure to the virus. So we put together a few slides that will hopefully put you a little bit more at ease if you're feeling anxious about making a trip to the drugstore. And there are a few kind of points and tips sprinkled in here to help you be better prepared as well. So first thing is first, relax. You may be able to actually skip physically going into a store if your pharmacy offers special services like your drive-through or delivery services. And we encourage the use of them because there's little interaction. There's low risk of contracting COVID in this capacity with whether you're doing a drive-through or delivery service. I know some pharmacies like Walgreens will deliver medication through a once weekly shipping. You may pay for that shipping or it may be free. And other stores and pharmacies that actually offer free delivery services, like a few independents that are around the area. So if you are going out though, as a normal walking into a pharmacy store, this presentation will actually help guide you through that process of visiting a pharmacy and running errands. So the best thing to do to begin with is to plan your trip. So in order to get really the most benefit out of your trip, I really recommend to make a list. You'll be able to spend the least amount of time in close quarters with the public, and you'll actually know where you're going. So you're not wandering around the store like I do all the time looking for things. So where do you need to go? Do you have to go to one place? Do you have to go to a few different places? Make a list for every place you need to go to and what you're going to get there. If you're going to a drive-through pharmacy, you can call ahead at the pharmacy and say, hey, I have a couple prescriptions I'm going to pick up. While I'm here, could I also pick up milk or soda or whatever it is that you were thinking of getting? And the staff there can get not only your prescription ready for you, but a couple of the little items that you requested as well. And that way, when you're at the drive-through, you're not taking up too much time at the window itself, and you have all of your meds and little extra things all ready for you. So really, you can ask, even if you're not going to the drive-through, you can ask to speak with a pharmacy staff member about your medicine. Make sure that you have the right medicine that you think that you're going to go pick up. How much might it be? Because sometimes if you're in a Medicare insurance plan, you might fall into a place where you've been paying X amount of dollars for your meds, and then all of a sudden you're in the donut hole and your copay shoots up into 25% range. And that's never a good surprise for anybody to come to when they're at the register trying to get their insulin and they find it's $300. So always great to call ahead, ask about copays, ask about vaccinations, because we can get all that paperwork ready for you in advance. So that way, when you come to the store in the pharmacy itself, all you have to really do is sign a little questionnaire, have a signature, and get your shots. So it really is a great idea to make a list. I have it all the time just because I forget literally everything. Don't hesitate to ask about anything at the pharmacy. You can keep your list handy with you when you're on your way out the door. So don't forget your list either. The other things to remember, you're going to want to remember your wallet, your cell phone, your keys. And we're always doing this where we always forget something. We have to go, oh, I got to go back and get that. For this part, I'm always forgetting the mask. So always remember to bring your mask with you. I like to keep mine kind of hanging in the car, either on the mirror or it can be hung on like the lever of the signaler for your directional. But you don't really need to wear it in the car unless you're actually driving with somebody that you don't normally live with or you don't normally see. That's usually the recommendation. So if you're alone driving, you don't need to wear it. If you're with somebody that you live with, you don't need to wear it in the car. But if you're picking up your neighbors that you don't normally see, you all should be kind of wearing the mask in the car just to reduce your risk of spreading to each other. And with that, we are now in the pharmacy. We've arrived here, and Mirna will take over from here.
Okay, so once you are at the pharmacy, it is important to remember to stand 6 feet away from another person, whether you are in line or browsing through the aisles at the store. However, social distancing yourself does not mean you cannot socialize. We know human interaction is very important. It's good for our mental health and emotional well-being. It's okay to have a conversation like you normally would, but just be aware of your surroundings and the personal space of others. You want to speak loudly if you're talking to someone 6 feet away and clearly so the person can hear through the mask. But make sure not to lower your mask while speaking to protect yourself and also to protect others. Again, you want to social distance when waiting in line. You want to speak clearly and louder than you normally would to staff because it may be more difficult to hear while you're wearing the mask. You can use hand sanitizers before and after interactions if you choose to. And it's usually provided at the pharmacy counter and mostly counter stores at every store that you kind of go to. To save time and trips to the pharmacy, When you are picking up for yourself, you can also consider picking up for living partners or family members as well. While you are there, you can ask your pharmacist any questions you may have about your prescriptions. So what kind of questions would you ask at the pharmacy? You could ask when to take your medicine, how to take it, do I take it with or without food? Is it best to take it in the morning or at night? What are some common side effects? What other over-the-counter drugs can I take with this medicine, or what other over-the-counter drugs or supplements should you avoid taking while on this medicine? So those are some examples of some questions you can ask the pharmacist while you are at the pharmacy. But if you do forget, it's okay to call the pharmacy once you're home. I will hand this off to Walaa, and she will be talking to you about what you can do once you get home from the pharmacy.
Hello, everyone. So you made it to the pharmacy, you made it out, and now you're back home. This is very, very crucial that when you come home, you literally drop everything and go to the bathroom, wash your hands. The 30-second rule is very, very important. Wash your hands with soap and water and keep the water, keep it running, keep scrubbing for 30 seconds. Sing a song, do something, but make sure you get those 30 seconds in. You could use alcohol-based hand sanitizer. I don't recommend it when you're at home because it does dry your skin. So we use it when we're outside just because you don't have an access to a faucet and soap. But when you do, go right ahead. It's not going to harm you, and wash your hands. And once you're done with washing your hands, dry it, go out, get everything that you had with you and sanitize it. So that purse that you laid on the counter when you were picking up something, your phone that you took out, the wallet, just take a wipe and wipe it down. Make sure that it's like an alcohol wipe. Just make sure, because you never know who's been there. Even though the pharmacy undergoes a sanitization every couple of days, maybe every day for some pharmacies, but you still never know who was there. The next thing that I want to emphasize is when you get home, just remember that in the pharmacy, we know what's kept in the fridge. Like when we pack your medicine, for example, the insulin, we know we label it and then we put it back in the fridge. It doesn't lay on the counter. So when you get 5 pens of insulin, you just keep the one that you're going to use out, but the others have to be stored. Might be very, very helpful to have something like that. Make sure you go through your meds, see what has the sticker of being refrigerated, what has the label of being outside of the refrigerator. Now we go next to what if I have a couple of meds that are not refrigerated? What happens? Can I just keep them anywhere? Normally, you want to keep them in a dry place where it's accessible to you. You don't want to keep them in the shower, the bathroom behind the mirror, just because it gets very, very humid in there and you don't know how the chemicals and the drugs are going to react to that. So you don't want to ruin the meds and call back and tell them, oh, I did that. You want to be on the safe side, always dry, non-moist place, which is maybe your bedstand, the nightstand is a good option. It's near you whenever you need it. You're not going to feel oh, I have to get up and go get it. No, it's right next to you. One other recommendation that I personally do it for my vitamins, is a pill box. So being at home so much might literally make you lose track of time. What day is it? Did I take my meds or not? What time is it? So having that pill box, doing it once weekly or once monthly, whatever you want, there are varieties of pill boxes out there that has the monthly, that has a weekly option with times 9 a.m., 10 a.m. Everything is labeled for you. Just sort them in and then you're good to go. You're literally reducing the chance of an error to very, very minor errors. One more thing is, if you feel like this is a burden for you, some pharmacies do offer pill packing. So you could ask the pharmacy, can you pack my pills into little slots where it's labeled by time? This might be an option. Some pharmacies do it for free. Some other pharmacies might charge you. But during COVID, I see that a lot of pharmacies are lenient with their policies, so it wouldn't harm to ask. The next thing that I want to talk about is It's okay to forget. We'll go to the pharmacy, we'll forget about the fact that, oh, I needed vitamin C, or I'm almost out of my levothyroxine. It's okay. We're the most accessible healthcare providers. The door is always open. A lot of pharmacies are open 24 hours. If not, we're open from like 9 to 9 or something. Some pick up the phone, call us, and we'll be glad to help you. As Mirna and Brittany said, if you forgot something, call us, tell us. You might not even have to come into the actual pharmacy. We might be able to help you through the drive-through if you're not feeling comfortable into coming to the pharmacy. Just let us know what you need and we'll gladly help you. My next point is, so know your mask. What do I mean by that? If you have a surgical disposable mask, it might not be smart to reuse it. It might be helpful if it's a disposable mask. It means that you throw it away. But if you have a cloth mask, like for example, you made it or you bought it and it's made out of fabric that you could wash, after it's not gonna take a lot of time to dry. First of all, just boil some water, put the mask in there with a little bit of detergent, for example, and then wash it, let it dry, reuse it. But don't keep reusing a surgical mask because you still never know where it went or where you went and who you were in contact with. My last point. So I was informed that most of the citizens in the house have been vaccinated. What does it mean to be vaccinated? It does not mean that we're going to take off our masks and walk around and, oh, I got my vaccine. Of course, we all want to do that. We're so tired of it. But up to now, there is no data or any like statements that came out of the CDC saying take off your masks if you got the two COVID vaccines, because there is not enough data yet. We're still tracking what's happening with us. Yes, it's safe to use, but what's happening really, we're not really sure if that's enough or not. But there are research saying that you could still contract it after getting the shot if you're not being precautious. So keep the masks on until we're 100% sure and the CDC lays out a statement saying take off your masks. And at that point, we'll all be happily taking off those masks and putting them away. And with that, I wrap up for the presentations. And what questions do you guys have for us?